I know we have Mladen Paluta here from South Africa who is co-moderating tomorrow. Mladen, you got a question about maybe the digital health innovations are not spreading as quickly across Africa. You know, I know there's some exceptions to that, like Stephen's work and others in South Africa, but maybe you can comment on that or ask your question to the wider faculty.
Thanks, Tom. Just a quick comment. Stephen, thank you for presentation. It was really a reference to a slide that Ricardo showed. Just to say that in the information that he showed that Africa was an outlier. But Africa is an outlier in many respects. We've got a young population and we've got different challenges. And so it's very exciting to see the kind of innovations that are coming up out of Africa, because in some cases we're starting with a clean slate. And I think countries like Kenya, Uganda, perhaps more fortunate than South Africa, in that they're able to implement a one solution for the country, whereas we have disparate, very complex systems that often don't talk to one another. So a very exciting space. Thank you, Stephen, and thank you all the presenters. It's been great.
Any other questions from any of the participants, or for that matter, from the fellow panelists?
Well, this is Elliot. I'll step in with a question in terms of for the concepts of the virtual hospital. What do those of you who are working in other countries or supporting other countries think about the potential for expanding the footprint and capability? And what is the time frame that you see in the regions that you're working with?
I know we're having presentations tomorrow from Ministry of Health Chile, where they have done digital hospital and maybe they've done virtual hospital. So there may be more coming on that. We've got a couple of our colleagues here from Peru, you know, and maybe Stipe or Rosanna, you want to speak to that? You know, what's happening with virtual hospitals, whether it's at home or some other location?
Certainly. Digital hospital is not just a very nice topic we have discussed in several arenas in Peru, but also in the regions. Some regions, Cajamarca is one of them, has been working very intensively in the development in that model. Actually, the advances are closer to the use of telemedicine in the context of some services, but we are developing gradually more bridges to make at least one or two locations on which a digital hospital will be based. The COVID-19, as all of you have shown, set us in Peru clearly not just the need, but the mission to achieve digital health as a short-term strategic and operational plan. Maybe Steve, you can give more information in addition.
Hi, Rosanna. Hi, everybody. So there are more in.
It's about digital hospital digital.
Yes. Now, can you hear me? It's okay.
Yeah.
Yeah.
Okay. Thank you. Okay, here in Peru, there is no too much experience with this. We are in the beginning on the digital hospital. Some institutes are beginning, some clinics, just the hospital of Cajamarca that mentioned Rosanna is started to do this kind of job, but we don't have yet implementation completed about this. This is something new, and we are working in have more infrastructure, connectivity, capacity of people who can administrate adequate technology. This is something that we have a few advances.
That's great, and I don't want to leave the impression that this has become the way we do healthcare in the U.S. The examples I gave are leading examples of organizations who are making progress, but by no means is this complete. We were probably 3, 4, 5% in terms of beginning to apply these tools.
Elliot, Luis in Mexico had a response.
Something that is very important for LMICs is user adoption. We're living a huge generational change where we were used to doing stuff on paper and on other systems like spreadsheets and all. And COVID has really pushed, especially the healthcare sector, to digitalize most of their functions. Telemedicine is something very big. Digital health is something very big, and it's really unfortunate because most countries in Latin America aren't really considering this as a tool and an investment for our larger population to be, diagnosed, treated, or rehabilitated. In the case of Mexico, we've done a great job on telehealth. Tomorrow we'll have Adrian Pacheco, who will be talking about what are we doing. But really on the medical device sector, it's something to be working on. As I mentioned on my presentation, H1N1 showed the first flag, then COVID-19 showed the second flag on medical equipment management. And I think that this is really a wake-up call on how important it is to have the right data at the right time.
I just would like to add the other aspect, two aspects in fact. One, the interconnectivity, interoperability, and the other one is the cybersecurity. We are in the region in average, as you can see in the information, so in the information provided. We are not yet in the correct way yet to make the best in the framework, regulatory framework and policies to protect the initiatives that are going on by the side of public sector and private sector. So if the region keeps working in this way, we are going to have more problems, huge problems, against, of course, the objectives of health we would like to achieve, right?
Great comment, Rosanna. And actually, we've got the world's guru on cyber on this screen right now. It's Axel Wirth, who mentioned that none of these other, at the beginning of this webinar, that none of these other innovations can happen unless we have a secure framework, for that to happen. And Axel has just been asked yesterday to put together a program 4 weeks from today on cyber. So that'll be our next webinar on July 28th. But Axel, a couple comments?
Well, I mean, this is certainly true for healthcare, but any other industry as well, and that is that we increasingly adopt digital technologies. We become a more attractive target. The attack surface grows, and our challenges are the attacker's opportunity. And we've seen that with many technology adoptions in the past, and we will continue to see that going forward. And clearly, doesn't matter whether you talk about 5G networks or artificial intelligence. Again, our challenge and our technology progress is the opportunity, and we've seen, unfortunately, many ways that attackers have found to monetize to our disadvantage.
This is kind of an all play here among the faculty. One of the Q&A questions from distinguished colleague Yanni Mueller is, can Stephen share more information about cross-border use of digital technology? Great question, Yanni. And Stephen?
Yeah, sure. Thanks so much. Actually, I just typed a long response, but yeah, so there's quite a bit going on. I just mentioned that one of the most important happened recently is the Africa CDC is a technical arm of the Africa Union, and I've been leading subcommittee within that task force to develop a standards and policy document for health information exchange, and the Africa CDC through Africa Union is going to is actually sending that out to all its member states to guide how to leverage digital health solutions for cross-border health. There are a couple of projects that have been sort of like flagship projects. One funded by USAID that we implemented immunization digital health solution called Journey. And we did that for the last 4 years between Kenya and Uganda border posts, We've also done one within 4 East African countries. So there's a bunch of those exemplar implementations. I'll share links to those, but it's quite a bit of that work going on right now. And Africa CDC is quite keen on that. I hope that's helpful.
Ricardo?
Yeah, Tom, I just want to expand a little bit on what Axel said, and something that is very important, and that seminar next seminar is fundamental, is users. We as clinical engineers worldwide become the first point of contact between all of those connected devices and the World Wide Web. And many times, because of the lack of education, we leave a back door open that then becomes an easy spot for a hacker to enter into our healthcare system. And that is not because we wanted to, just we didn't have the education, training, and resources. So I want to applaud all of what Tom and the team has been doing, because this is fundamental for everyone to know what things are needed so that we can move forward and improve healthcare for all. Thank you.
Very good point, Ricardo, and that's why it's so important that organizations like PAHO and WHO focus a lot, not just in the patient-centered approach, but the population-centered approach. And in that regard, the role of clinical engineers, as you state, is so important. And most of all, the awareness from us clinical engineers about the role we have in digital health is essential now.
I'd like to call on colleague Riyad Farah from Lebanon to speak about some of the Eastern Mediterranean Regional Office of WHO, also known as Middle East North Africa perspectives. Riyad?
Hello, everyone. It's a wonderful webinar. Thank you for the presenters. Great information. Honestly speaking, EMRO is just like any other area of the world. We don't have a unified vision or strategy for digital health. We have lots of countries with advanced vision. They have a strategy, they know where they're going, they plan for it, and they're working on it step by step, whereby other countries, they still lag behind naturally because of no availability of resources. We have KSA, maybe one of the countries in our area with a vision and a strategy on digital health. The Arab Hospital Federation is trying to work on a strategy and trying to unify the vision for all the countries in EMRO region. Hopefully this will improve the focus on areas whereby we can work together towards a common interest to the patients in EMRO region. I would like to point out that COVID, just like any other areas of the world, it helped pushing more and more for need for solutions with the distance, and telehealth is picking up after COVID. Of course, we are so far from the services that Elliot explained in the States. We are still far behind from this, but telemedicine is picking up. The interoperability varies from areas to another areas. In some countries, we have the private sector much more advanced in the interoperability, whereby in other areas, the governmental institutions, they're still maybe lacking behind. And in other countries, it's the other way around. Cybersecurity is picking up. And I find lots of interest in our area, just like any other area, AI, telehealth, cybersecurity. We are so hungry towards knowing more and more about all of these. I believe that we don't have the option. We as clinical engineers, we are as healthcare service providers, we need to work on this. Patients, they need immediate response, they need immediate information, and they need support they work a lot using their mobile devices. So we all see that things are shifting towards telehealth, digital health, and finally, I just want to stress on what Barun said as well. Well, actually, the COVID showed the importance of clinical engineers, and the work of clinical engineers work everywhere. So I just want to stress out on this point. It was an occasion to show the importance of clinical engineers all over the world. Thank you very much, and a great webinar. Thank you.
Okay, thank you. And we have one question here specific for Pedro. The question is, can you explain more about the telemedicine tool implemented and what are the challenges presented during the project? Pedro, if you could please respond.
Pedro, you might be on mute right now.
I think he might be having connection problems.
Okay. So why don't we move on then? And we do need to wrap up in a couple of minutes here, but open question probably for many of the experts here on the panel. What are the top three post-COVID innovations globally? So it's a very broad question, but I think we'll get some interesting opinions here around the table.
Elliot, I'd have to go with your telehealth / virtual hospital or virtual care delivery.
Well, no question. The use of these tools has become ubiquitous, even if it's a telephone consultation. The ability to engage with a patient where they are at the moment they need support. And now there are many more tools emerging, depending on bandwidth, depending on local capacity and infrastructure. And I would say 2 or 3 years ago, we heard, even in the US, that physicians will never use these tools. Nurses don't know how to use these tools. Old patients can't use these tools. The coronavirus has forced everybody to consider using these tools because they're the only tools that have been available. So that's a great outcome in a sense, but then it also exposes the kind of soft underbelly of infrastructure, equity, access, technology, et cetera. And another area that Stephen really didn't talk about, but a question was asked about global tools, global data exchange tools, and the like. And I think that Stephen's using tools and representing tools that are actually open source, standards-based tools that the community has developed and is sharing. OpenHIE, for example, is an IAG-friendly system that's available for open sharing. There are open source patient data management tools like OpenMRS that also use standards-based. David, do you have any thoughts or experiences to share about that?
Yeah, thanks a lot, Elliot. Yeah, sorry, I didn't mention specific tools, but that's exactly what I meant when I said global goods. So, so I would say the topmost innovations, if that counts as going back to the question, would be exactly what you mentioned. So, OpenHIE for managing data exchange and interoperability, that's used in many countries and actually formally recognized in many countries by governments like Kenya, Uganda. I would say like probably half countries in Africa. OpenMRS is the most dominant for medical records management. Then you have DHIS2, District Health Information System. And then you have a bunch of mHealth like Rapid Pro and all that. So if you have time to look at the global goods, a lot of those are used in Africa. And I think as Elliot has mentioned, most of them are standards based. So out of the box, they make it very easy for us to innovate on them, do all sorts of adaptation and actually get them used. So really exciting times. And I think lastly, what Elliot mentioned, I think for me, the biggest innovation, and it's just the ability for everyone in the healthcare system, the consumers of healthcare services and the providers to use tools as simple as telephones to just call and talk about the healthcare. Thank you.
I think one specific area where we all have been challenged, and I think we still will be solving the challenge for years to come, is this new need to track health information in a disparate environment. It doesn't matter whether it was contact tracing across a broad population, or whether it was the collection and distribution of test results, where all of a sudden it was not just your healthcare provider taking the sample and giving you the result a couple of days later. You went to a collection facility somewhere, the sample was analyzed somewhere, and the result had to get back to you somehow, right? And I think that whole distributed infrastructure it was a new challenge for all health systems in the world, and certainly requires some innovative thinking going forward.
Well, Axel, what a great job, you and Almir, who had to just depart, and more to come tomorrow. And thanks, everybody. So we'll meet at the same time tomorrow with another great group. And I think many of you saw the note that there's one speaker change from India, Dr. Jatendra Sharma. And a month from now, as I mentioned, we'll go deeper with cybersecurity. Thanks, everybody, and see you tomorrow. Bye for now.
Bye.
Okay, thanks, everybody.
Bye.
Bye.
Have a great day, everyone.
Thank you.
See
Bye.
you. Thank you. Bye.